We are going to move on now. We went from composites to Extraction CE. One of my favorite sponsors is going to be coming up with his team. There is Carl. Carl and I had lunch together in Philadelphia prior to the pandemic. When I think he knows this story, I was a young dentist. I went with my dad to the Greater New York meeting, and I'm going this week. And you were so ahead of your time, Carl. We watched you extract a tooth on video in Utah while we were in New York. Blew my mind. I think this was like 2004 or 5. So what you do for dentists is amazing. Truly appreciate it. Your whole team can come. Do you want your whole team to come on video now, or that you're going to call them up later?
Yeah, they can. They can.
Okay, cool.
Yeah, that was at Ultradent, by the way, in their studio.
Oh yeah, that was awesome. Now, before we launch on what you're talking about, this is Gratitude Week. So not only am I grateful for you guys being sponsors and helping our community, but gratitude stories are important. So one of my coaching clients, I will leave him nameless. He said, Paul, I want to make my career better. Paul, I want to do things better. I said, you got to take Carl's extraction course. And he did it, extraction and implants. And he was one of your recent participants. And we shared it on Instagram. And he took out a loan through Dr. Doc Lending to go there. And he came back and said, Paul, it was worth it. So I just want to tell you, I appreciate you transforming these dentists' lives in creating these opportunities for them. It's what dentistry needs more of.
Well, you know, Paul, I'm grateful for you and all that you do and the things we've been able to do together. And I know I can't do this forever. I'll do it as long as I can, but I'm glad to have people like these two that you're looking at here, Dr. Drollinger and Dr. Elam. I mean, they're younger than me. They're more distinguished than me, and they're really good teachers. So I'm glad to have them here too. You know, as we start to talk about something, can I just show a few pictures?
Yeah, show a few pictures. And I always like to orient everyone. So let's go with each person here. We can start with Dr. Andrew. What do you do, Andrew, to help dentists live their best life?
Wow, that's a big question. But I think what I'm here to talk about is the fact that I share the same passion as Carl Koerner does, and that's empowering general dentists to do more. So I help teach dentists how to remove teeth, and not the easy ones, the most challenging upper first molars, canines, the whole 9 yards.
I love that. You could share your screen whenever you're ready, Carl. You're welcome to do that. But let's go over to Dr. Barry. You're still on mute there. You can unmute yourself. Thanks for being polite.
I'll be a little less polite now.
No. It was nice. Whenever people mute themselves to come on, they're very polite people, but then they forget to unmute. So I appreciate it, Dr. Barry.
Good to see you, Paul.
What do you do in the world of helping dentists live their best life?
This is through oral implantology, helping my colleagues get to where they're comfortable placing implants and restoring them, and flying solo in their own offices and doing it in a systematic way.
I like that. And Carl, I'm going to turn over to you in a second, but I do want to tell you a story. So Dental Nachos is about JBN, just be nice. So if someone does a crown and you thought you would have done a filling, you're not supposed to call them the worst dentist on planet Earth, right? That's our JBN. But our just be real mentality is to talk about some of the real things impacting our dental profession that are problematic, from dental student debt to dental schools not delivering enough reps, and to dentists being difficult with each other. So I just want to share with you, last night in my phone, and this is someone texted me and I shared it. He said, I am a general dentist that can extract wisdom teeth, and I work for a DSO, and I work with a DSO, and the oral surgeon that works with our DSO is a bit temperamental because I like to take out third molars. And he said he would report me to the board if I take out third molars. How would you navigate this? So in the JBR, just real world, before you launch into the clinical part, have you seen some of these turf wars, Carl, over your career? I think I know the answer, but turf wars.
You know, the fact is that until just a few years ago, like at our school, they were teaching all the students to do easier third molars. Things have become a little more political, you might say, or economically competitive just in the last few years. I taught at UOP recently, and I had a couple UCSF students in there. After the course, I said, how many of you did surgical extractions in your dental school before you graduated last year? And both of them in unison said none. So we see that conspiracy going on. they're just not teaching dental students how to do much surgery anymore. And the next step to doing those, and maybe this is why oral surgeons feel that way, is because it could be easier wisdom teeth. Third molars, the easier ones, if you select your case right, you can do those. And, let's face it, if you attended an AEGD or a general practice residency or an oral surgery internship, all of those are general dentists doing that.
Right.
All of them are taking place right now throughout the country. All of them are going to do easier third molars. So for him to pick out one person to pick on is a little unfair.
I am totally with you. And I tag my team member. I want you to tag them as sponsors because there's a lot of good conversation here. And then I said, I'm an oral surgery resident, almost finished. And when a GP friend of mine asked about wisdom teeth extractions, I answer him his questions and I tell him I'm happy to do a case with him together. So Dental Nachos has the ABC always be collaborating mentality. And I'm going to turn it over to you, Carl, to share some details about your amazing CE programs.
Let me say, I love your acronyms that
Thanks.
So
Thanks.
to show a few things here, a few pictures. This one is probably our bread and butter course. This is one that everyone should have. It takes you from doing simple ones timidly to being able to do others. You will still refer some cases, of course, but this shows on a model doing about 8 different things. The main one being to do a surgical extraction, and then the root if it breaks, knowing how to do that quickly. So Dr. Drollinger teaches this course. I teach this course. Dr. Mukin teaches this course. We offer it around the country and especially in Houston and Chicago. And you can see someone working on the models. This happens to be in Virginia a few weeks ago. And then we have another set of courses that is where we actually treat patients. Now, these are 60 patients that come from indigent community. Some are refugees, some don't have jobs, some are fixed income, whatever the reason may be. They try to get in with an oral surgeon and they can't because they don't take Medicaid or it's too far away or whatever. But in this course, we just do for 3 days, one surgical extraction after another, not even stopping for lunch. You take lunch when you can, you go get a burrito in the break room. And this shows one instructor and 2 dentists. So every 2 dentists that attends this has their own personal instructor. We switch them every day, though, to rotate for 3 days. When they get done,
awesome.
They are totally different. And the big news is that all our courses are waitlisted. So we're now opening up to do this every other month in the Dominican Republic, opening up more courses in different parts of Utah as well. So that's one of the things I especially want to share. So this shows Dr. Drollinger. This is another doctor. Even at the break, even for breakfast when we're having our huddle, they're learning. They're eating something. They've got their fork in their hand, but they're learning something from the instructor. And even in the hall, if we have waiting a few minutes, that's actually an oral and maxillofacial surgeon there, however, who's on our faculty teaching. Just you learn just as much that way sometimes. And then with regard to our implants, the big thing is it's patient treatment in the US. It's doing for every segment of patient treatment, we do 3 or 4 implants.
And I just want to interject, Carl. I only interject with good ideas. I don't interrupt. My wife says that all the time. Don't ask her, but just take my word for it. When we get to this implant portion, or even going back to the one about extractions, don't go back on the slide. Just to reinforce, can you have a license in any state? Do you need a license in a specific state? If somebody's watching and wants to sign up for one of these courses, where do they need a license from?
Well, first of all, if we go back to the other one where we treat patients, the state board has said that if you're taking Dr. Koerner's course, you don't need to, you need to have a license, but you don't need to have a Utah license.
Cool.
Just because of our reputation, they grant them the ability to do that. So that's not an issue. And it's not an issue with Dr. Hillam with implants because it's taught as part of the dental school CE. So it's in conjunction with the dental school. So that helps insurance wise, and it helps license wise as well. So we are fortunate, we're blessed to have some of those things happening. And this, just a couple more and we're done. This is Dr. Hillam. These students, they don't just hear something and go do something. they have to work up a treatment plan. They have to defend that treatment plan to their peers before they do a case. And that's what's being done. And they're being grilled and having to come up with why they're doing the treatment. And Dr. Hillam could say that way better than I. And this is just this is back to the team of the surgical extractions in this case. And then the last thing, and the last slide will be that we just finished making about an hour-long video with a clinician researcher at the VA in Salt Lake City. And it's actually, the title of it would be What Every General Practitioner Must Know About Bisphosphonates and MONJ, because that, as you know, no one really understands that well. It's all over the map. And general dentists have a hard time keeping up. And with this video, what Dr. Griffin does is he goes into this for the GP, what they need to know, what they need to do to be level with the playing field and to be able to do things according to current standards of care. This can be our Friday the 13th, or Black Friday, not 13th, but just the Black Friday special that we have and that we could offer. It's on our website right now for free if you're with Nachos.
That's awesome. So they can get this. I mean, I have to share. You're so right. Like I remember even like 15 years ago, I was trying to do an implant and extraction. I asked the medical doctor about the bisphosphonates. They said, "What do you think?" I said, "Aren't you supposed to help me?" Right? So it can just become ultra confusing. And I think that delivering some real education. So I want my team to share this in the comments and then share with me how they can get this at no cost through Nachos and learn from this.
Okay, that if you don't already have it, I'll give it to you. All they have to do, it's down for $100 on the website, but if they do the code, then it's free for them.
Is the code Nachos?
The code is MRONJ.
MRONJ. That's pretty good too. But we feel we could add a Nacho. But I like you've named a lot of things. MRONJ. And all right, make sure we share that. So I love this. If I can spend a few more minutes chatting with both of you, if you don't have any more slides, you can bring everything back up space. So I love this share. And a couple of things I want to ask you guys. I'll start with you, Dr. Barry, with implants. We talk a lot about transforming patients' lives, right? I talk about Janice. We got 10,000 views on YouTube. She did an implant over denture. It's fun. It's funny. I transformed Janice's life. But what you guys are doing is transforming dentists' lives. So when did you graduate from school, Dr. Barry?
2004.
2004, I was 2002. So talk to me a little bit about how the dentists feel at this course, whether they enjoy the camaraderie, whether they finally get a chance to kind of learn from a bigger, stronger dentist in a supportive way. How are you transforming the lives of dentists through this, whether it's at the course or when they go back to the operatory?
Both of those things are happening. I'm happy to say that. And what I mean by that is that I'm starting to hear from course attendees that have taken our live patient course 2 and 3 times who are saying, I'm flying solo in my own office now. And this is very gratifying to see. So that's happening. Now at the course itself, these doctors are coming exquisitely prepared. I'm very proud of them. They're coming in with treatment plans ready to go, as Carl mentioned a moment ago. They're presenting them to their peers. They're discussing all the parameters that you would expect to be discussed in a good implant treatment plan. They're manipulating Blue Sky Plan software as they do that in front of the group. So they're already adept at that. And when they go back to their office, that's no barrier for them. They're ready to take a DICOM file off of any CBCT machine, work it up, look at it according to height, width, bone density, any other anatomical hazards or ridge topography issues, anything like that. Yeah. And they're able to move forward. And they're trained very well prior to this live patient course, so they're coming with confidence. It's
catch me up if I'm right. I've been working with Carl for because there is some training prior to the live patient course online, right?
That's right.
How this works?
Yes.
So they have an opportunity to start their educational process before they show up for the patient surgery.
Yes. I'm calling this the entry point continuum. When you place implants, there are many times when you need to make a calculated decision as to when to enter the tissue and where to enter the tissue and how to manipulate it.
Yeah.
Then there's where to enter the bone and then how to manipulate the bone as you go. And so many things revolve around this entry point. And in the implant training landscape, I think there's also a real challenge in front of general dentists today. Where do you enter this game? Where do you go? I talked to a lot of people who have taken something like an AAID Maxi course. That's a 300-hour training program and invaluable, really wonderful information. I'd recommend that anybody takes an AAID Maxi course. But it's very common to talk to attendees from those programs who really still have not implemented implants in
Right.
their own practices.
I call it
They're
the
still not flying
Goldilocks.
solo.
I call it the Goldilocks C program of too much, too little, just right. Right. I mean, people are signing up without any experience to like learn how to be an NBA basketball player. I'm like, have you ever shot a basket? Not once. Right. And then on the other side of that, which is likely more dangerous, people are like, you want to get in an NBA game? You played pickup once. Right. So this Goldilocks problem, I think you're really solving of, not too much, not too little. I wanted to ask you a question, Dr. Andrew, with the extractions. Talk to me a little bit about going to the course to flying solo, right? I mean, either whether it's best practices, case evaluation. I mean, I want to think of this question, but both through having children, working in a hospital, my own medical procedure, dentistry has a lot of problems. When you go to a hospital, first-year resident, chief resident, attending, they're all working on you. They're all learning at the same time. Us as customers or patients, we think, man, we're getting great care, right? But then you go to the dental office, where if you bring more than one dentist in the private practice setting, they start to freak out, which is wildly unfair to the dentist, right? I mean, just crazily unfair. But you started with it, right? How do these dentists go from the course to flying solo?
Well, that's the beauty of the Continuum One course, is it's that middle stepping stone from going from I don't know what to do to doing this all by myself in my office. So not only is the Continuum One course a foundational surgical course with all of the didactics that's needed, but then we have the hands-on model component. So we are going to spend a couple of hours discussing the steps involved to a surgical extraction, all of the didactic knowledge. We then pause and we can then practice that on the model itself. So awesome. Whether it be, everybody that takes this course starts the course at a different level. Some people have never even attempted a surgical extraction, and some people are there to learn how to just do them better and faster and with more confidence. So it really serves the purpose of helping to get the opportunity to practice that skill set before actually trying it out on an actual patient.
Awesome. I mean, I'll give a couple more minutes with you guys because I was going to now what we forget about the general dentist, and not even you guys anymore, because you may have a general dentist background, but I'm assuming most of you are doing this thing most of the time on patients, right? Have you done a lot of class 2s, Dr. Barry, in the last year? If you have them, I admire you.
I've done a few. I've done plenty in my career.
But you've started to kind of have this sub focus, right? And Dr. Andrew, the same thing. But we're training people, because I'm going to ask you about your favorite side dishes. So there's a restaurant in Philadelphia called Schlesinger's. Okay, it's a diner. They got chicken noodle soup, they got Greek salads, and they have a Thanksgiving dinner on the menu every day. So imagine how hard it is to cook at that place. You got to constantly be shifting gears, right? And that's what us general dentists who are traditional, it's hard. I mean, I'll never forget my attending at my GPR said the hardest thing is to go, you're doing a class 2, you're taking out a tooth, you want to place an implant. And that's why specialists, I believe, I don't know, I actually think they have happier lives, right? Not about the money, but they go, I just do root canals. All I have to do is troubleshoot root canals. So I want to ask you, Carl, what is your favorite Thanksgiving side dish, Carl?
I think it would have to be the raspberry cream pie. That's
I like that.
$20, but only once or twice a year.
And Dr. Barry, how about you?
I was going to say pie, but I thought that was kind of that was a bit of a cheat, Carl, because that's dessert,
Yeah.
But it was going to be raspberry pie for me. But I'm an Idahoan through and through, so it's mashed potatoes, and they're good.
How about you, Andrew?
It's got to be the jiggly cranberry.
Oh yeah, I like that the can marks on the side. I'm stuffing. But now what I kind of want to, well, first I want to share, people can text, call the 215-543-6454, get the best deal possible. Carl, your team's awesome. If someone just goes to the Koerner Center website and says, I'm with Nachos, will your team help them get the sponsor discount?
Yeah, they will get a discount, and it's usually about 10%. I think we have a special deal right now on the implant patient treatment. So there are some that if we've discounted it severely already, for a limited time, we all can't always do that. But
Yeah, I understand that. Yeah, but they can go there and say the Nacho Group discount. We have our text code. But what I want to wrap up with in an inspirational way is, and I still have to connect you to the amazing general dentist who did the Navy and works in my office and just takes out teeth, right? Just like you guys. He only does extractions, oral surgery procedures. Maybe just share, like, there's an opportunity for people who take this CE to create a career for themselves to maximize their own happiness. And that might be being the person in their practice that just does exodontine implants. It might be traveling around the country. It might be hiring an associate to do your restorative work. Kind of tell our audience about your career journey. I'll start with you, Dr. Andrew, and how you got here. And maybe someone would be inspired by that watching this.
Well, so yeah, Mike, I took a very non-traditional career route. I did an oral surgery internship at UCLA many years ago. I spent many years as an associate, several years as an owner, and ultimately ended up in academics doing oral surgery full time in the oral surgery department, and that's something that I really loved quite a bit. And now I don't do general dentistry very much anymore. Most of my career at this point is oral surgery, and that's very non-traditional.
And I think it's cool. I mean, there's some lot of challenges with dentistry, some crises, but there's a lot of cool opportunities to create a career. But Andrew, you must miss those class 3 composites on 7 ml where you had to put the little Mylar strip in and it crinkled, then you put it in again. I know you missed those days.
Of course, yeah.
Dr.
It's
Barry,
not all good.
how about you?
A career path. Maybe I'll start here. I had a dear friend. His name was Eric Vogel. Eric's not with us anymore, but if you use the Nomad X-ray, you might know who Eric is. He invented that.
Wow.
Eric and I taught together for several years at Brigham Young University, and I was not oriented surgically particularly at that time. And he told me that I really must get into implantology. So he offered to have me work up a case, an upper premolar, go to his office, and place that under his tutelage. I did that, and I did that with his great. He was an amazing teacher. When we were all done, he had some blue CSR wrap over the cabinetry, and he took out a magic marker and he said, "You know what platform switching is?" And I said, "No, I don't know what that is." So he drew that out and he said, "That's why this implant is so great that you just placed." It was an old ankylose implant. When I left that, he gave me a little warning when we were done. He said, "You're going to want to go do this in your own office, but get some real training, get formal training, get a formal introduction to this discipline before you move further." It was at that point that I didn't have such a thing. I didn't know where to turn. I was concerned about what's the right expression? Raising the hackles of my specialist friends in moving into this territory and placing implants. So I wasn't sure what direction to go in, and maybe I'll skip through a lot of the steps that got me to where I am today. But suffice it to say that I know what it's like to want that training and to want to be able to do it well at the highest possible standard, and how to draw boundaries around cases that are good for you to do to begin with. Starter cases, as I like to call them. And they have to be very carefully designed and very carefully chosen, and then executed in a systematic way. And this is what I personally have come to learn to do in my own practice, and I do it regularly. And I just got back last week from a course in Mexico. I'm passionate about teaching implantology on the surgical side in a live patient setting, and also providing a didactic foundation that can really give you the grounding that you need and the confidence you need to go in.
I absolutely love that. I've taught some people just think I sprouted up out of Facebook in 2017, but I was alive before then. And I have personally taught 50 my first implant courses with dentists. And I would give this lecture of like case selection, and don't do these. So if it had any of these factors, don't do them, right? And it was a really good one because it kept people safe, right? Like I described it driving a car, like drive around a high school parking lot, move to a side street. You guys aren't Philadelphians, but Route 76 is one of the craziest routes in all of the country. So if you got in your car and drove on this road, you might hurt yourself, you might hurt someone else, but even worse, you get out of the car and never want to do it again. So I love that case selection adjunct. And Carl, you did something over the pandemic with a dentist who was able to find associate jobs and help patients. And you said something in the beginning, when you become one of these dentists that can do this, you can help patients who might not be able to get in with an oral surgeon or have to travel so far. And that's why we get into doing this. Tell me a little bit, whether it's your own personal career or people you've trained, how they've been able to expand the help for patients who might not be able to travel for that.
You mean how we've helped dentists to be able to do that?
Or just even you, I mean, like what you had shared with this, you guys have created this special set of skills, like Liam Neeson from that movie Take It. You should say, I have very special skills and hold up your elevator. So I've been a little bit like, I've lived in Philadelphia, New Jersey, and there's enough specialists around that I don't have to do anything I don't want to do ever. And actually, that's very nice, right? If I don't feel like doing an endo, I can get someone in with an endodontist the next day. You know, if I don't want to take out a tooth, there's 5 oral surgeons that I can get them to. But some of these dentists that are graduating from school and finding some of these jobs in areas where their specialists could be 2 hours away, I just think it's very cool how you've created a career path for them to do this.
Well, you know, it all started, well, first of all, it started in the Army. I went to the University of Washington. It's a great school, but, you know, I didn't do a lot of surgery. But when I got in the Army, whoa, I got into a hospital the week out of school, and I had 10 cases I had to do. They were mostly all third molars. And I did that for a whole month, day after day after day. And so, you know, I learned fast. And then I went into general practice at the end of that residency program. And I found that I loved surgery because of that experience in the Army, and then being at a base where I had to do a lot of it. I just had more of a love for that. And after about 7 years, I started to get burned out with regular dentistry. And I thought, you know, to really enjoy this career, I want to do what I love. And so I started doing more surgery. Then I took an ortho class just because I wanted to be a little diverse for a while there. And I saw how the general dentist who was teaching teaching orthodontics, I saw how he did that. And I just put surgery in that mix. And I started doing it the way he did, only with surgery instead of orthodontics. And it took off from there. And I've been doing it ever since, all these years.
I just think it's so cool. I don't share that much about my dad. He was an amazing dentist, and I should share more about him. He did the military, he did the Air Force. You know, sadly, he passed away in 2016, but we worked together for 11 years. And I think when you do the military, he was an extraction guy too, right? His whole career, so much so that towards the end of his career in life, we had a very VIP patient who my dad loved and loved my dad, broken off endo-treated tooth. I'm like, Dad, don't take this tooth out. He goes, I'm taking it out. I go, don't take it out. He goes, I'm taking it out. So I went into the operatory because it was taking a long time, right? Because it was broken down. And the patient was there, my dad was there. And we're now like 20 minutes late for lunch. I looked at them and my dad, and I said, are you glad you did this? And the patient said, your dad's still undefeated with extracting my teeth. And it was just such a cool moment. It does show you that you have to have the right relationships with people, because I don't know if a brand new patient would have done that. But I just think this whole theme of you're extracting true pain from people. And the more you can do this, the better your career gets. And I think you guys are just showing that on this show.
Well, and nowadays you don't just use an elevator and a forceps. You can actually excise roots by, which is the standard of care now, to use a skinny burr in the PDL and go 3/4 of the root length down, and then use a luxator. So things have changed. If you're doing it the old way, you really need to be brought up to speed.
And the thing is, we do Dentist Job Connect, helping hire associates. And I'll share that if you're an associate dentist who has skill level with extractions, you're very valuable, because the owner dentist who's running around like a maniac, refereeing the team, doing restorative cases, they're sort of like, here, take out this person's tooth, right? And they'll even give you extra time, right? Because the patient doesn't have to leave the office. So you guys, I will share, are doing the work of the Lord G.V. Black. Okay, you are helping dentists do better. Before we wrap up, anything else I missed or anything else you'd like to share?
Well, I don't know. We are just grateful to you for giving us this
Thanks.
platform and this opportunity, and we hope it's can be viewed by a lot of people. But most of all, I hope that it gives them the confidence to want to do more. This economy is terrible. There's going to be less endo. There's going to be less cosmetic work, you know, because of not having the money to do it. So I think this is going to be a big need in people's lives if they can learn how to do this.
I totally agree. Well, thanks, guys. You guys are great. Have an awesome Thanksgiving. Stick around for a minute, but Nacho crew are going to jump off. Thanks, guys.
And bye.